Welcome all. I am Dr. Deepti Mahajan. I am a consultant pediatrician at Motherhood Hospital, Sarjapur. I am working in the field of pediatrics for past 20 years. Today we are going to have an interesting discussion about urinary tract infection in children. Urinary tract consists of the kidneys where the urine is being formed. Then there are ureters which bring the urine down to the urinary bladder where the urine is collected, and then there is a urethra through which the urine comes out. Infection can involve any part of this urinary tract, and it is much more common to have a lower urinary tract involvement where the bladder and the urethra is involved. This is called cystitis. To have involvement of the kidneys is much less common, and it is much more severe infection, requires much more aggressive treatment. Now, what are the signs and symptoms of UTI? For mild UTI, the signs and symptoms could be fever. There could be burning micturition, that is, the child complains pain while passing urine. There could be frequency of micturition, the child passes urine multiple times, much more than normal. There could be foul smelling urine, abdominal pain, vomiting, and there could be night bedwetting in a child who was previously well controlled. Then in case of severe UTI, there could be high grade fever with chills, there could be low blood pressure, abdominal pain, vomiting, poor oral intake. What are the age groups where UTI is more common? Urinary tract infection is more common in children less than 5 years of the age. Out of that, less than 1 year, it is more common in case of boys, and above 1 year till the age of 5 years, it is more common in case of girls. That is because they have got shorter urethra and which get frequently contaminated with the fecal matter. What are the risk factors for urinary tract infection? Frequent use of diapers, children who have a habit of holding the urine, children with history of constipation, presence of certain stones in the kidney which is called nephrolithiasis, presence of certain congenital malformation of the kidney, family history of UTI, they all predispose children to have UTI. How to diagnose urinary tract infection? First of all, there is a clinical history which suggests us about UTI symptoms. There is a need to do the urine test, that is urine routine, which can pick up the increase in the number of the pus cells. And more than 6 to 8 pus cells per high power field indicate UTI. Urine culture, which will pick up the bacteria which is causing UTI. Coming to the treatment of UTI. For mild UTI, we need antibiotics, oral antibiotic, which is given on an average for the 7 to 10 days duration. Also, good hydration, taking care of the hygiene, and avoiding constipation is important. For severe UTI, when the kidneys are involved, usually IV antibiotics are preferred, and the child is usually treated in a hospital setting with IV fluids, IV antibiotic, and other supportive treatment. What is a recurrent UTI? UTI, when it happens more than twice in a child who is less than 5 years, is called recurrent UTI. In that case, we need to explore a little more in detail why the UTI is happening more frequently. There are certain specific set of investigations like ultrasonography. Then there is a micturating cystourethrogram, which is a kind of a special X-ray where we can see that when the child passes urine, it goes in a correct way. It doesn't go the wrong way. It doesn't go up to the ureters, which indicates the presence of reflux. We can also do a DMSA scan, which will tell us about the presence of appropriate position of the kidney, shape, size of the kidney, presence of any congenital malformation, and presence of scarring because of the UTI. So if we are getting the recurrent UTI, we can go ahead with these investigations. How to prevent UTI in children? Reduce the use of diaper, avoid constipation, local hygiene, genital area should be washed regularly with soap and water, and taking care of the hydration. So this is all in brief about pediatric UTI, and I hope it is useful to the viewers. Thank you very much.
Motherhood Hospitals. We care like no other.